Sarecycline is a tetracycline antibiotic used to treat inflammatory lesions of non-nodular moderate to severe acne vulgaris. In this video, let's found. What is sarecycline? What is sarecycline used for? Contraindication. What are the side effects of taking sarecycline? How does sarecycline work? How to use sarecycline? What is sarecycline? Sarecycline, sold under the brand name Seysara, is a narrow-spectrum tetracycline-derived antibiotic medication. It is specifically designed for the treatment of acne, and was approved by the FDA in October 2018 for the treatment of inflammatory lesions of non-nodular moderate to severe acne vulgaris in patients 9 years of age and older. What is sarecycline used for? Sarecycline is a tetracycline class drug indicated for the treatment of inflammatory lesions of non-nodular moderate to severe acne vulgaris in patients 9 years of age and older. Contraindication. Contraindicated in hypersensitivity to sarecycline or other tetracycline antibiotics. OB. Pregnancy may lead to permanent staining of teeth and inhibition of bone growth in fetus if used during second or third trimester. Lactation. Petty, children less than or equal to 8 years, may lead to permanent staining of teeth and growth. Side effects. Common side effects include blurred vision, change in the ability to see colors, especially blue or yellow, fever, headache, increased sensitivity of the skin to sunlight, itching, skin rash, nausea, pain. Pharmacodynamic. Compared to various examples of first-line tetracycline therapies for moderate to severe acne like doxycycline and minocycline, studies have shown that sarecycline can be 16 to 32-fold less active against aerobic gram-negative bacilli present within the normal human intestinal microbiome. Furthermore, it has also been demonstrated that sarecycline may be 4 to 8-fold less active against various anaerobic bacteria that also comprise the normal human intestinal microbiome. Subsequently, while doxycycline and minocycline typically elicit broad-spectrum antimicrobial activity that can often cause adverse effects like diarrhea, fungal overgrowth, vaginal candidiasis, etc., due to undesirable off-target antibacterial effects on endogenous intestinal flora, sarecycline demonstrates a noticeably more target-specific narrow-spectrum activity with lower incidence of such side effects. Moreover, sarecycline also shares a relatively low propensity for resistance development in Cutibacterium acnes, one of the principal anaerobic organisms associated with acne lesions, with doxycycline and minocycline treatments. Mechanism of action. It has been demonstrated that tetracyclines like sarecycline elicit their antimicrobial action by targeting and inhibiting protein synthesis in microbial agents like Cutibacterium acnes present in acne lesions. In particular, it is believed that sarecycline's mechanism of action revolves around the inhibition of various macromolecular biosynthesis activities like the macromolecular biosynthesis of microbial DNA, RNA, proteins, lipids, and cell wall. Specifically, it has been observed that while sarecycline demonstrates appreciable inhibition of microbial macromolecular DNA and protein synthesis, the compound has little to no effect on lipid biosynthesis, cell wall synthesis, and RNA synthesis. In addition, because Cutibacterium acnes also generates proteins and enzymes that are capable of causing inflammation, it is also believed that tetracyclines like sarecyclines can also affect an anti-inflammatory effect via the inhibition of such microbial protein synthesis. Half-life. The mean elimination half-life of sarecycline is 21 to 22 hours. Dose. Acne vulgaris. Indicated for treatment of inflammatory lesions of non-nodular moderate to severe acne. Less than 54 kilograms, 60 milligrams, PO/Q-day. 55 to 84 kilograms, 100 milligrams, PO/Q-day. 85 to 136 kilograms, 150 milligrams, PO/Q-day. If improvement after 12 weeks not observed, reassess treatment. Safety advice. US FDA pregnancy category, not assigned. Risk summary. This drug, like tetracycline class agents, may cause fetal harm, permanent tooth discoloration, and reversible bone growth inhibition when used during pregnancy. Insufficient data available to inform a drug-related risk for birth defects or miscarriage. That's all the information about Sarecycline we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.